let's go through case number one. Case number one is a person who's got some foot pain. It would be really great if someone can tell me what they think is going on, but this person has come in with chronic, so basically pain for quite a long time, and they don't know what's causing their pain. And they've come in for this X-ray, and initially I think it was reported as normal actually, because it doesn't look too bad at first glance. But as you kind of use a system, then you do start to know, you will hopefully notice the problem. And the way I do these things is I try and go for what I'd say the high yield areas first. And so what you do, you just kind of go to the metatarsal heads and make sure that they are not completely flattened, and they don't look very sclerotic, because if they look sclerotic or hyperdense and flattened, then you're probably looking at something along the lines of Freiberg's infraction, which is not the case here, because actually if you look at those metatarsal heads, they look very, very normal indeed. The next place I'd be looking at is going to be the base of the fifth metatarsal over here, because that is generally speaking where people do get fractures. This situation, we can't see a fracture here. That looks very, very smooth, not much in the way of soft tissue swelling. Some of you may have noticed this little area over here, and you're thinking, okay, mate, how do I know that that's not a fracture? It's not a fracture, it's just a small ossicle. Very, very common. You can have that along that region as well, and there are a few areas that you can get ossicles, but this is one of those ossicles that we're not going to be worried about at all. Right, so another high yield area would be to look at the distal fibula. That's a very cheeky place that sometimes these fractures can get missed, because someone comes in with foot pain and they don't really realize that their pain is actually coming up much further up than their foot is actually coming up from their ankle. So quite important, you do end up having a look at those very sort of significant areas. But at the moment, we haven't seen anything particularly abnormal. But next and final check area, I've got a few more check areas, but this is another one, the terminal tufts, right? And this is the common problem. And for those of you that may be watching the previous talks, people would assume it's soft tissue overlying everything, which is fine. In this particular situation, it is. But then also people sometimes don't realize that there is the nail bed. So sometimes you can just see the faint outline of the nail just sitting like this, okay? And actually, in fact, I had this really straight, well, it was a bit silly actually. I had a hand x-ray because someone had chronic pain in their hands. And genuinely, in their toe and their nail, they had these three little kind of calcifications sitting there. And I thought, wow, that's cool. That's like soft tissue calcifications. We're thinking about some sort of inflammatory process going on. There could be scleroderma or something like that, calcinosis, like Crest syndrome. So I was like looking it all up, and I was like, this is awesome. I've got this. And then I realized, on the other hand, it was symmetrical to the point that the pattern of it was exactly the same. And what it was the person was obviously getting their nails done and had a little bit of a design on their nail, and it was the same on both sides. So there was my Crest syndrome out the window, so never mind. But anyway, great for the patient and not so interesting for me in the end, but I did save it, hopefully to try to trick someone later on when I'm doing my 2B teaching. So again, so you have a look at the nails. No one's come out with the answer yet, so maybe you guys are a little bit stumped by what this one is. So look at the nails, look at the terminal tufts, make sure that there's no obvious abnormalities there. And all these terminal tufts look okay. And the reason I look at that is because people sometimes get stamped on. They may stub their toe on the end of the bed or something. I mean, we've all been there, haven't we? But what can happen is that you got to then look at the metatarsal shafts, right? And just have a good look through. So we're going to zoom in. Probably that's a bit too much, I think. And just make sure it's nice and crisp all the way along. Look at this shaft as well. You also want to make sure there's no osteochondral defect in the region of the metatarsal head as well. So that looks okay. It doesn't look like there's any defects there. Not much in the way of a hallux valgus deformity. No one's saying anything yet. Okay, fine. Okay, so we're going to keep looking. Let's pan this bit. Look at the shaft going along. Looks smooth. And then you look at the sort of 1, 2, 3, third shaft. Can you see it kind of looks a little bit hazy there? So what I'll do, I'll get the pen and draw it out. Look, going along like this. And then it doesn't look so crisp. And then it kind of carries on like so. And this side looks completely fine, but that side does not look good at all. It looks very, very irregular, very, very cloudy. It looks very, very cloudy around there. So that doesn't look quite right. And then you just want to make sure that the rest of the metatarsals are okay and no gross abnormalities anywhere else. But there is a sort of sclerotic appearance over here. Is that visible in the other view? Let's have a quick look. So we do have two views on this particular occasion. Let's zoom in. Sometimes we can confirm or refute or just not be completely sure. 1, 2, 3. Yeah, a little bit hazy, but not as obvious. But this is what is known as a stress fracture. So that's the diagnosis in this particular occasion. You can see a small stress fracture at the metatarsal shaft of the third toe. So I think it's quite a subtle one. And I think when you're kind of sifting through loads of cases, you may miss that. So very, very important that you kind of, what I always try and do is try and look at the places that other people don't look, because that's what I'm being paid for.